Thank you, Sue, and welcome to everyone from around the world to this week's Institute of Coaching webinar called Lift Your Talent, Exploring the Value of Coaching in Healthcare. As Sue indicated, my name is Jeffrey Hull. I'm the Executive Director of the Institute of Coaching, and I am super excited to be here with our two special guest speakers, Dr. Lara Salms and Dr. Anna de Pagter. So we are particularly excited about this session because this will be the first webinar we've had that is connected directly to the gift from the International Coaching Federation of over $500,000 to support research with the Institute of Coaching. So this has been a super exciting program that we started a little over a year ago, and we're really grateful to the International Coach Federation for sponsoring and supporting this kind of research. This is really one of the things that makes the Institute of Coaching a very special place, and we are super honored to have these wonderful researchers with us today, all the way from Amsterdam and Rotterdam in the Netherlands. And I want to give you a little bit of their background, but I want to take a minute to just welcome everyone. Good afternoon or good evening from wherever you are around the world. Please take a minute to say hello, because we love to see, we have a huge audience with us today, and we love to see where people are coming from. So say hello in the chat box and where you're from. And I'll just take a minute to give you a little background. This project around coaching in healthcare research was funded, as I said, through the Institute of Coaching with an award from ICF. Our very first inaugural recipients of this award for scientific inquiry went to Dr. Lara Salms and Dr. Anna Pagter. And so they are still in the midst of their research. And so they are giving us an update of the work that's ongoing. But we are really happy to have them here to tell us a little bit more about the project, how it's unfolding, how it came together, and most importantly, the impact that ultimately it will have for the healthcare profession here in the Netherlands, but also for coaches all around the world. So let me share a little bit of their backgrounds. Dr. Lara Salms is a postdoctoral researcher at the University of Amsterdam. Her PhD project at the Erasmus Medical Center focused on the effectiveness of coaching for medical professionals and the psychological mechanisms that underlie positive coaching outcomes. And I'm excited to be able to announce that she's just recently completed her PhD, so we are wanting to congratulate her for that. Also, as part of this team, Dr. Anna de Pagter is an associate professor and pediatric hematologist at the Erasmus Medical Center in Rotterdam. She is a clinician, but also a coach, and she founded a program called the Challenge and Support Program, which offers development-oriented coaching to healthcare professionals at all levels of a number of different healthcare institutions all across the Netherlands. So together, they have put together this really powerful research program. It's one of the first of its size and scope in the world, focused on burnout and the impact of coaching in the healthcare space. So we are super excited to have partnered with them to make this a reality. So I'm going to turn it over to Anna and Lara, but I'd also just want to remind, we have a big audience today, so please do your best to put the questions in the Q&A box if possible. We're going to have plenty of time toward the end of the presentation to take as many of your questions as we can. And feel free to use the chat box to start networking and sharing different thoughts as they come up for you during the presentation. And with that, I'll turn it over to the two of you. Welcome, Anna. Welcome, Lara.
Thank you so much. Thank you, Jeff, and Sue for this wonderful introduction. And moreover, thank you so much that we can call us IOC grantees. We are not only really grateful for the grant we received, but more grateful to find the synergy with all of you here in the audience and all the experts at IOC to bring coaching research further and finally to improve quality of care in our healthcare systems. Thank you for that, and we will do our utmost to share our results and experiences with you. Today we will talk about the movement we started, about coaching of healthcare professionals, different professionalities throughout the Netherlands. Next, Lara will share some detailed information about her research she did during her PhD. And there was already a question, can we receive some link towards the thesis? And that's of course possible. And afterwards, we will wrap up with some information how to move on and where we can build on this international network to improve even more. This program and initiative and finally movement has started from 2 university medical centers in the Netherlands. Leiden University Medical Center and Erasmus Medical Center founded this project, the founding parents, and we continued the research in our research network together with the experts from work and organizational psychology of the University of Amsterdam. And not only the practical background from the clinicians here are really important, but more the experts from the organizational and work psychology. Together, we found a synergy to co-create this program and to not only implement coaching, but also doing robust research to the efficacy of it. And I think that was really powerful in the way we started all of this. And why are we here now? Why are we doing this webinar? I'm a clinician. When I'm in daily, oh, something's moving on, I'm sorry for that. There we go. I'm a clinician. When I'm seeing my pediatric patients, I need evidence-based treatment options to treat them and to discuss with my patients and share decision-making what to do. And that evidence-based research of treatment options are really important. What's working and what's not. Looking at lifelong learning and development of healthcare professionals ourselves, research is relatively scarce. Evidence is relatively scarce. Research and coaching, of course, in this audience is a very big topic, but in healthcare, it's relatively scarce. And that's why we started all of this. Because true, good, optimal quality of care needs a very essential ingredient, namely highly engaged people, professionals in the workplace. And therefore, we think that coaching can really be of benefit to optimize professional development of all the healthcare professionals to finally improve quality of care. So our main goal is to improve quality of care for our patients. And we all know there are lots of challenges in healthcare, increasing workload, time pressure, stigma for support. But that means there's an urgent need for developmental coaching to support that lifelong learning. And I'm so grateful that we're here together with more than 250 people to discuss about that. If we think about I have to wait a little for the next slide. Let's see if it's moving. Not yet. If we look at quality of care as a basis, we know that there's a direct interaction between well-being of physicians, healthcare professionals, and outcome of patient care. If we look at that, we know that if there's a symptom of burnout in a professional like cynicism or exhaustion, we see a doubling of lower patient satisfaction. We see a doubling of the risk to be involved in patient safety incidents. And most interestingly, we see a 2.5 times higher risk for lower professional behavior. not following guidelines, involved in claims, inadequate education to patients about their treatment options, for example, and lower empathy. And of course, this will not only influence the patient interaction, but also in the team of professionals. And therefore, I'm really engaged to improve well-being and engagement of all healthcare professionals. Because I think if we have an engaged person interacting with the patients, best care will be given at that time. And thanks to the people from Stanford and so on to evaluate this already before we started this program. I hope it will move on now. There we go. Of course, if we look at professional development, coaching is a very essential ingredient of that, but luckily there are more options to improve. In the field of professional development, there are many interventions mentioned in literature to be effective. Most in the non-healthcare organizations, but there is some experience and scarce research available for these topics. And some examples I named here. Next to developmental coaching, we also know that team coaching can be of benefit, peer support, so colleagues one-on-one to support each other in a non-hierarchical way, and mentoring in a role model system where you can learn from each other, more in a junior-senior interaction. And all these forms of support can really be of benefit to keep on learning even after your training in MD or nursing. And then after saying all of this, I would like to state that being a pediatrician, I was not familiar with coaching, not at all. Actually, there was a little stigma on the topic. I thought as an MD, I have to figure it out myself. During a training, I was offered executive coaching. And my first reaction was negative. I don't need that. I don't have a problem. But looking at coaching from the other way around, lifelong learning and development, changed my mind. It influenced my career very intensely. I changed my specialty towards pediatric hematology, which fits best with my motivation and talents. And that's what I would like to offer to all of us, to be so engaged in your job that it's a pleasure to help all your patients. And therefore we started this program, not only for implementing coaching, highly qualified coaching for all doctors, nurses, residents, and students, but moreover to improve that quality of care. And therefore, to extend it, we need the research, of course, to learn what is best and most effective, and to see whether it fits optimal in the set goals for the individuals themselves, the teams, and the organizations. And that's the mission we have, improving patient care by fostering professional personal development for all the healthcare professionals, and thereby optimize the learning culture and quality of care. And I'm really happy and grateful that Lara can share some of her research data and will say something what to do next.
Hey, yeah, hi everyone, also from my side. It's really exciting to be here and have so many people listen to you talk about this research program that we set up together. I will walk you through, let's see if I can move to the next slide. It's not working, sorry for that. Okay, it is now. Okay, so I will walk you through the research that we did in the past 5 years as part of the Challenge and Support program and my PhD work, to give you a little bit of a background, what we studied, what were the main questions, research questions that we had, and also where we are coming from for this new study, the Lift Your Talent study that is funded by the IOC. So I will walk you through it in a nutshell, and don't be worried, I will not go too much into depth into the methods, but just want to give you an idea of the questions and also the findings that we had over the years. As many of you know, probably physician well-being is increasingly at risk, both in the US, but also here in Europe. Burnout is a major problem. It depends a little bit on in what journals you look, but often 1 out of 4 physicians are reportedly being burned out. The reason why that is the case is often seen in the working culture of physicians that is characterized by very high stressful demands, time pressure, difficult patient interactions, emotionally demanding patient interactions, often also in combination with a high clerical workload, so paperwork that needs to get done on top of all the clinical work that physicians have to do. And often, sadly, this is in combination with a lack of resources, such as only limited support or limited developmental opportunities. So in a way, it's not really a surprise that burnout and, generally speaking, physician unwell-being is, what has become such a major problem. And why is it so problematic? Of course, the first problematic thing about it is that it impacts the individual physician in terms of their own well-being and their own health. We also know that physicians who are burned out often are absent from their work for a long time, sometimes not even returning to the medical field altogether. But also, as Anna already pointed out beforehand, physicians who are exhausted and burned out are more likely to engage in unprofessional behaviors, in conflicts, and at the end of the day are also less likely to deliver high quality care. So this was the starting point of our research line, if you want, 5 years ago. And we thought, how can we identify effective strategies to promote the well-being of physicians based on the general data out there showing that physician well-being is really increasingly at risk. So this was the major question that we had for our research line or my PhD. And to answer this question, before even zooming in on coaching as an effective means to potentially promote physician well-being, we wanted to know what are the risk and protective factors, generally speaking, of physician well-being. So what is it at the workplace, in the medical culture, or generally speaking, in terms of the demands and resources that physicians are experiencing, that is either hampering physician well-being or, on the other side, promoting physician well-being. So this was the first question that we had before even looking at type of interventions such as coaching. And what we found in our first study was that job demands were most predictive of burnout symptoms, such as cynicism or exhaustion. Job demands are the things in our work that typically cost us energy, the things that we have to do that are part of our job descriptions, and that typically cost us a lot of energy. So they are most responsible for burnout symptoms. But what we also found is that resources, and they can be found either in people themselves, in terms of their positive qualities, such as, for instance, resilience or optimism, but can also lie within the work environment, so peers or colleagues that give support to you, that can also all be resources. And we found that those resources were most predictive of work engagement. So why this was true generally for different physicians at different career stages, what we found is that physicians who are more experienced, like already working as independent specialists compared to medical residents who are still in training, they did not always benefit from the same type of resources. We concluded that, okay, if that is the case, that people do not all need the same thing to benefit for their well-being, then maybe what we need is very personalized, individualized support programs. And one way, and you all know that, is coaching, or through coaching. So this is why in our second study, we were looking at the effectiveness of an individual coaching program to improve physician well-being and functioning. So basically, having seen from the study beforehand that what we might need is a more individualized or tailored approach to physician well-being, maybe coaching could be an effective means to do so. Coaching is, as many of you know, a very systematic, typically short-term intervention. And in our program, coaching consisted of 6 individual face-to-face coaching sessions, where in one-on-one sessions, a coach and a coachee would work on personally meaningful goals. That means that these goals could relate to anything developmental or not. And we, as program managers and researchers, were not really involved in the content of the sessions, but we're just tracking the changes in well-being over time. And what we found when we tracked those physicians over time during approximately 10 months that the coaching lasted, we saw that they experienced a number of positive outcomes or benefits after coaching. So we saw that they improved their job and personal resources, such as they experienced more autonomy and more psychological capital, which is a bit of a psychological term, but it basically is a mix out of positive character traits like optimism and resilience and hope, and they all together make you feel good and perform well. But we also, and very importantly, saw that symptoms of burnout were reduced by coaching. So we concluded from the study that maybe coaching is not just an effective means to reduce burnout right away, but also potentially prevent its onset through strengthening of job and personal resources. Then Anna already also mentioned it a little bit at the beginning, that there are a number of different types of interventions that organizations can use to target well-being and performance. And this is also what we were interested in this next study, where we looked at the benefits of coaching compared to other types of support interventions. So we wanted to know, okay, coaching is quite intensive, both for coaches, but also for organizations in terms of the costs that are associated with it. So maybe some other interventions who are less extensive might be just as effective. Who knows? So we did the study amid the COVID-19 pandemic, and that meant 2 things. On the one hand, it meant that there were a lot of support initiatives being initiated in healthcare organizations to support physicians during this time of extreme stress. But it also meant that physicians who were already stressed and strained were even more so in that particular period. So in that sense, it was a very almost experimental setup that we had to study this phenomenon of burnout during COVID-19. And what we found is when we tracked physicians during a period of 8 months, so we asked them over and over again every month how they were doing and to what extent they were making use of certain interventions that were offered at the workplace, we found that professional support, which included coaching, had a positive effect on work engagement. So in other words, the more frequently those professionals were making use of interventions like coaching, the more engaged over time they were. So in a way, this showed us what we already knew from our first intervention study, but now also in a critical or more strained period. And then a very interesting finding, and that was that group support interventions, which are frequently also used in healthcare organizations in the Netherlands, often in terms of intervention or like small peer groups that get together to exchange and discuss, we found that that actually had a negative impact on exhaustion. So again, and contrary to what we expected, the more often people would participate in group support interventions over time, so during these 8 months of COVID-19, the more likely they would end up being exhausted. So we concluded from the study that while professional support might still have positive benefits for healthcare professionals, even in times of extreme stress, other type of interventions, such as group support, might not actually work that well under extreme circumstances like COVID-19. Okay, this brings me already to our last study, which was less focused on the pure effectiveness of coaching. Does it work? Is it effective? The first studies focused more on that, but rather this study focused on the underlying mechanisms of coaching. So what is going on in coaching? It's typically behind closed doors. So we certainly as researchers don't really know what is happening. I think many of you out there know much better than we what is happening. So what we tried in this study is really figure out or find out what is the effect of different methods or questioning techniques that coaches can use. And probably also many of you are familiar with these different kind of methods, which is solution-focused and problem-focused questioning. So solution-focused questioning is really all about making sure or allowing a client to think about their own strengths, to work towards solutions relatively quickly without thinking too much about where a problem comes from or what's the origin of a problem, but really relatively quickly going towards finding solutions to a particular developmental question or problem. And compared to that, problem-focused questioning, I already mentioned it, is much more about trying to figure out where a problem comes from, where it originates from, and by eliminating that root cause, working slowly towards a solution. So what we did here is we compared in an experimental setting, which meant that there were some physicians who were being asked solution-focused questions, and then there were some physicians who were being asked problem-focused questions. And that all happened not in a real coaching setting, but rather people were at home behind their computer doing a self-coaching writing exercise, as we call it. So they would answer these kind of questions, but not being in interaction with a real coach, but more like a simulation, you could say. And we found that questions about solutions, they made people overall more happy and less unhappy than questions about the problem did. Maybe that's also not so crazy. If someone asks us about a problem, of course, we're not gonna get so happy about it. If someone, on the other hand, makes us think about how things can be solved, then yeah, that probably puts us in a better mood. But what was interesting about this was that both type of questions were evenly effective when it came down to behavior change. So in terms of what we measured here was action planning and goal attainment. So in both groups, physicians made equal improvements in terms of their more goal-directed behavior. So we concluded from this study that when the goal of coaching is to make people feel better, feel good, then solution-focused coaching questions are probably the preferred choice. But on the other hand, when the goal of coaching is to stimulate action planning, behavior change, which often it is at the end of the day, then both type of questions can be used equally. Like I said at the beginning, the overall aim of all these studies, if you want, was to figure out what are those effective strategies that we could use to promote physician well-being, on potentially counteract burnout and promote work engagement with the ultimate goal of improving patient care. This is just a short summary. I will really quickly walk through it, but we showed in the first study that it was really personal and job resources that promoted well-being, but that physicians at different career stages benefit from different type of resources. So we concluded that it's important to tailor support to those specific needs that physicians at different career stages might need. We showed that coaching works. It improves well-being, reduces burnout symptoms, and increases job and personal resources. We saw that it still works under elevated stress like COVID-19, but other type of interventions like peer support did not and even made things worse. And finally, zooming in on the coaching process, we showed that different type of questions can have different type of effects. But if it comes to action planning and behavior change, then both these type of questions are equally effective. Okay, so this was a really quick run through into all these studies. I hope it's interesting to you and maybe give some ideas about what is the type of research that we are doing in terms of coaching research. And what we concluded from this is that, yes, coaching is a very effective means to improve physician well-being, but it also is a very individualized intervention. So it doesn't necessarily target outcomes at the organizational or system level, but if we really want to address the causes and origins of physician and nurse burnout and unwell-being, we also have to address these underlying, the underlying causes of unwell-being and burnout. And this brings me to the project that we are currently investigating, the Lift Your Talent project, because here we are trying to make the step from individualized outcomes or individualized coaching to potentially spillover effects. So the question that we are asking is, could potentially coaching me have effects on the colleague I work with? So this is something that is very novel in the field of coaching research. There's very little been done about these type of spillover effects, and in our study we're trying to see if potentially that could be the case, and hopefully making a contribution to these system level changes or effects, if you want. So I will zoom in a little bit more on this project. So what we have been doing in the past year, a little bit more even now, is that more than 100 nurses here in the Netherlands have been coached across 2 major academic hospitals, the ones that Anna mentioned at the beginning of the webinar. And what these nurses enroll in is, of course, a voluntary coaching program, one-on-one, where they receive 5 individual face-to-face coaching sessions with a professional coach that they themselves have chosen. So we as a program make a selection of accredited professional coaches, and then the coachees can pick a coach of their liking based on short clips that we post online, where the coaches introduce themselves and tell a little bit about their way of working. And what is also important to mention here, I think, and that's similar to the studies that we did as part of my PhD, is that people are always free to talk about whatever type of things they want in coaching. So we as the program, or maybe management, we do not have any type of saying in these type of questions, and also don't really have any way of knowing much about it. So it's very much behind closed doors again. But I think that's important to say, because it also means that people are really, they can really trust that whatever they tell the coach is not being shared and is not being used in any type of way for other means. Okay, so we as the research team, what we are doing is, next to that the coaching is taking place, we are tracking participants' well-being, such as burnout, across 3 occasions. That means we are looking at how they're doing before coaching, how they're doing after coaching, and also long-term, a couple of months later, to see if coaching also has more long-term effects on their well-being. And then the important and probably most interesting part in terms of the novelty of our research is that we are also asking the close colleagues of these coached nurses to report back on us. So what we're doing here is trying to get an idea of that spillover or ripple effect that I mentioned we know little about yet, to see if colleagues that work closely with coach nurses do see some sort of change happening in the person that is being coached. The data collection is still ongoing, so we are still in the middle of it. Unfortunately, at this point, we can't share any results yet, but hopefully we will be able to do that very soon. Yeah, I think this is it for now in terms of the research project, and then Anna will take it from here again. I will approve this.
Thank you, Lara, and audience. You can imagine that I'm a proud supervisor of Lara and all our team to see what she performed in the last years doing her PhD. Thank you also for all the questions in the Q&A. There are some questions about why did the physicians join in your program? Why did you, so myself, join coaching while you were a little negative about it? So I would like to add something to that, and I will try to move on to the next slide, because that will take some time maybe. Thank you for those questions. And I shared my personal experience with coaching, and how that it positively affected my career. And I think there are several points of the program really important about this. The highly qualified selected coaches who were independent and external of our hospital, because the confidentiality of the coaching trajectory is essential. So none of the data discussed will be shared with supervisors, educators, managers. And I think that was for all the doctors a really important thing in our program. The culture in healthcare is mentioned in several questions in your remarks. And I think that's a really interesting one. Why did this program extend nationwide in more than 20 hospitals and more than 150 groups of physicians and other healthcare professionals like nurses, students, PhD students? I think this was designed workplace-based, so a practice-based approach we took. From the needs assessment from the physicians themselves, we created this program. So the physicians themselves were the ambassadors for their colleagues. And that peer-to-peer storytelling contact, reducing the stigma or taboo on this topic, really changed a little bit of the culture. That's currently still how we do this program. One of the doctors, we call them challengers, share their story, share their the research data from our program, the evidence of the effect of coaching with a group of doctors. In that group, we will start the interaction, the conversation about this topic. And from there on, every individual can voluntarily join in our program on a one-on-one connection with the coach. And there's another very important aspect of our program. Everyone can pick their own coach, because we know from other IOC highly rewarded experts that the match with your coach is very essential for optimal effect. So they can pick their own coach from videos throughout on our website, and they can start their trajectory in 10 months. Next, the robustness of the research is a highly valued part of our movement. We do not only try to implement this throughout the medical profession, but we also would like to evaluate very clearly what the effect of coaching is, to create a state-of-the-art program available for as much as healthcare professionals as possible. And via this robust design with a randomized controlled trial, we try to really evaluate the true effect of coaching. And that's what we did for the doctors. You saw the data in the studies from Lara's, and that's what we try to do now for the nurses too, for the medical students and for the PhD students. Because another thing is, if you would like to implement this really specified on the needs of your target group, we need to know those needs. So every program part is designed with a group of professionals in a co-creation to build a specified program for that group. And again, one of those peers will share their stories to their peers, and then throughout storytelling and evidence data, we will bring the movement further. And therefore, we speak of a movement of healthcare workers to extend this cultural change and this way of looking at lifelong learning. And coaching is a perfect intervention to start with. And hopefully, other interventions will follow soon. Also was mentioned in the Q&A, what about team coaching and what about the results Lara shared? And Lara will get into detail about that later on. What was meant by the group sessions is more like colleague debriefings, so not professionally supported group meetings. And we saw an increased exhaustion in those non-professionally supported group meetings. I think that's a remark. Hopefully that's an answer on your question. And I hope we will create a very healthy health system. That's what I would like to share based on your question. Thank you for that. Does coaching is different in healthcare compared to other high pressure settings? Thank you, Ross, for that question. That's a good question. We did not compare that in our studies. There's more research done in coaching on other high pressure settings, but scarce in healthcare. And it would be really interesting to combine. And I think since the robustness of this study is, makes it more, makes it a good design to repeat maybe in other professionalities and to evaluate. If we look at that system change, I really like that question, and Lara showed us already that within the IOC-funded Lift Your Talent study, we evaluate not only the individual effect for the nurse, but also on her team. Does increased reflection or engagement via coaching will also positively influence your team? Of course, that's a really important question to answer for programs like this. And therefore, I would like to share this model with you. Our movement, I think it's a great example of not only implementing coaching for the individuals, but also have a system benefit of the research line. We are trying to make coaching available, low-key available for healthcare professionals to improve their engagement, resilience, autonomy, and less exhaustion. Next, I hope this is working now. Next, hopefully this will influence the team too. Team dynamics, safety climate. If someone's trained in more reflection habits, probably that will also positively influence the team climate too. And that is a very important piece of system change in your organization, because we can also make a difference. We can always make a difference between we are the individuals, this is the system, but systems never change systems themselves. We change systems. And via the monitoring and the evaluation in the research, we hopefully can add information into the system to create that system change. And in the end, that will positively influence quality of care. So by the robust monitoring via the research line of all the participants in this program, while they had their own coaching for their own benefits, we create a needs assessment for the system. And the PhD student who's currently working in our program after Lara did, Anna Stojanovic and Dan Fris, he's working on the medical students part, they did an evaluation of all the coaching goals who were brought in the programs via the participants. In their questionnaires, before they started coaching, they named what they would like to discuss with their coach. And actually, that's a lot of information which you can aggregate. And there were important themes out of it for example, our Department of Human Resource or our quality departments. And that can be of great value to design programs which fits the needs of our workers. And I think that feedback loop will eventually not only improve our coaching program even more, because we can learn from what the participants will put in, but also our healthcare system itself. And that, of course, will optimize the care we all need, especially in the very future changes in the healthcare systems with the challenges we face in the near future. And a system change is never a monodisciplinary movement. Only using coaching for doctors will never really change the culture in a whole organization. And therefore, I'm really proud that the small start we made with challenge and support in a couple of groups of doctors turned out to be extended nationwide. More than 1,300 doctors are coached now, but also created coaching programs for other disciplinaries in the healthcare. For example, the students in the healthcare studies. We have the Match Your Future program. For the nurses, we have the Lift Your Talent program Lara told you about. And for the PhD students, we recently started Match Your Future program for PhDs. And I think this will be of benefit to add positive interventions for development of all our healthcare colleagues and to change culture. We spoke a lot now about the programs we do here, and I would love to get into the Q&A again with all of you, but also a challenge for you, because if you hear this and you're working in your own organization or as a coach, what would be your challenge to be once helping challenger to improve lifelong development of the healthcare workers? Because I think we are all in the system change. Thank you so much for listening. And I hope to show you really soon more data about the Lift Your Talent project, because we are both very excited to see the results of that. And again, I would like to thank all of you and the IOC for making this possible, because via this excellent network of experts, we all help to improve research even more. So thank you. Jeff, I will give the floor to you again.
Thank you. I am super excited to have the opportunity to hear the research that you've been doing, how it's going. And I mean, we're just so proud to be part of this project. I think we didn't get too many into the numbers. So before we let you go, because we only have a few minutes, but I think one of the things that's most impressive about this project is the scope, because there have been studies of the effectiveness of coaching in healthcare settings before, but this is definitely one of the largest that's ever been conducted. So if you want to just briefly, one of the two of you, whoever wants to touch base on the number of hospitals, the number of people that have been involved, it's actually pretty impressive. Who wants to answer?
Currently, we have over 1,400 doctors involved in the program Challenge and Support. We have more than 450 medical students involved in the Match Your Future program. And with the randomized controlled trial setting, we have over 100 nurses involved in the Lift Your Talent group. And of course, they were all divided in an immediate intervention starting group. So they started early in the project, and in the waiting list control group, and they had to wait 10 months before they can start. So they are currently doing their coaching trajectory at the moment. And for the PhD students, we will open tomorrow for signing. So that's really exciting. But there's what we experience during the co-creation with the PhD students, we experience a high need for support like this.
It's really exciting because I think that there's been a number of smaller studies and interventions, but to have hundreds of coaching sessions, hundreds of coaches, hundreds of doctors and nurses involved. And you've also done a random access control set. So you can really look at what makes a difference in terms of people that get coaching and don't get coaching. And I know that a couple of folks have already asked the questions in the Q&A about the longer term impact. And Lara, you mentioned that, right? That the next phase of your study, do you want to say something about that? Is whether or not it's, one and done, they said, is not necessarily what you're looking for, but long term. So want to say something about that?
Yeah, so that's a very good criticism also for the field, generally speaking, because a lot of the coaching intervention studies look at the direct effects of coaching and not so much at the long-term effects. I mean, it's definitely developing, and there are a couple of studies out there. And this is also what we are doing in Lift Your Talent, really look at when I say long-term, what I mean is 6 months, but still, yeah, that is what we would see as a more long-term effect of coaching. And basically what we're doing is we are asking coached nurses again after those 6 months, a couple questions, surveys about their well-being, how they're doing now, what kind of changes they have made potentially after finishing coaching. Yeah.
That's great, because I think that one of the things that we're all interested in, and it came up in the Q&A early, is the more systemic impact of coaching and developing a coaching culture. So that one of the interesting questions that came up, and I'm not going to find the name of the person, so I apologize, but I think it would be great to ask it, which is, I'm not sure which one of you, or whether it was together, that you made the case for the institution to fund and to be behind coaching, but how did you convince the administrators or the people that have the budget to do this kind of research, to do this kind of work?
We are really proud and lucky of our hospitals I am working in, because they pioneered in funding the startup of this program. And next, we were granted some grants, some research grants to continue the research. So we started really small. And of course, this was all started from very highly motivated people throughout the organization who all helped voluntarily to build this. And currently, we're working on a more future-proof organization, which hopefully can help a lot of organizations throughout the Netherlands. And if we do that together, that will build on quality. And I think it will benefit for all the organizations if you have a quality measure and monitoring on top of programs like this you offer to your healthcare workers. So that's great. Work in progress.
Right. And also you were able to demonstrate that you had some funding, like from the Institute of Coaching and other places. So it didn't all have to come.
No, and the evidence is really important for sustainability of programs like this. Because we can really enthusiastically start, but now we can prove that it's working. And that's, I think, really important to build further on a scope of evidence-based interventions.
Absolutely. No, and that's why I think it's so exciting. I mean, the chat has been blowing up with folks that are very, very excited about this, connecting with each other, having conversations about where they're trying these kinds of interventions, and really the global impact. Because I mean, if you look at the list of where people are from on this webinar, they're from all over the world. So, you know, this is something, burnout, you know, feeling stress, well-being, there are topics that are impacting not just healthcare, but it's probably more egregious or more noticeable in the healthcare space than any other. So we are super excited to have been able to support this. One thing I want to mention, because you brought it up, Lara, was that you're studying the ripple effect of coaching at this point in your next phase. And those of you that are interested in this topic may want to look at the website from the Institute of Coaching into the work of Sean O'Connor, who actually was one of our early funded projects a few years ago. And he did a study in a business setting of the ripple effect of coaching, which is actually really interesting, and published that there was a positive outcome, that when leaders were coached, there's actually a 1, 2, or even 3 levels away where the people were positively impacted, and it impacted the entire culture. So you might want to look up that work if this interests you. The name again is Sean O'Connor, and it was called The Coaching Ripple Effect. And I assume that you folks will also have something similar to that coming up soon. So we're really excited that you're looking at both the longer term impact, the ripple effect. It's really powerful. So I'm super excited that the Institute can be in partnership with you about this.
Me too.
And Jeff, let me just say that it's as a scientist, it's not that common that, I mean, it's common that you do research, but it's not that common and always even appreciated all the time that you also broadcast your message and share your results, like in terms of science communication. So I also want to thank you, not just for funding, but also, and all the listeners, to giving us the floor to talk about it, because I think that's just as important as doing the research, who maybe not so many people would read in an academic paper. So I think Anna and I, we're also really grateful for that part of it. Yeah.
Well, thank you. I think that that's really one of our passions at the Institute of Coaching, is to support evidence-based research, to support the scientific underpinnings of what we know works intuitively. But as Anna said at the beginning, when you're working with doctors or scientists or any other, especially technical folks in any environment, they want data. They want to know for sure that this was worth the investment. So we're committed to partnering with folks like you that are doing these larger interventions, and then getting that information out to our coaches all over the world. That's going to make the biggest difference. So it takes both sides, and we're honored to be part of it. And I want to thank the two of you for this incredible project. I mean, it really is one of the largest studies of coaching in a healthcare setting that's been done to date. We're super excited that we're able to be part of it. And we will come back to you, since it's ongoing, and 6 months from now and 12 months from now. I will say that there's so many questions, and we did get to a few of them, but there's people wanting to know how you evaluated well-being, what kind of assessments you use. So the good news, everyone, is we will be keeping the Q&A, and we will be sharing it with Anna and Lara so that they can respond to the questions. Obviously, not going to get to it tonight since it's late in the day for them. But hopefully you'll read through the questions. You'll be able to get back to some of the folks, because there's really great questions here. And we will also keep the chat and share it all with the people that attended. So with that, I think we're running out of time, unfortunately, but I just want to thank you again for being part of this program. I also want to thank the International Coach Federation, the ICF, because this is where the rubber hits the road. You know, they are partnering with us. They have been responsible for the funding, and we are super grateful to them. And hopefully this is the beginning of many projects of this type that we will continue to support and work with you. So thank you both. It's been a pleasure.
Thank you.
Thank you.
And thank you, everyone. listening.
Thank you all for joining us. Hopefully we'll see you again very soon. And if you're not a member of the Institute of Coaching, please consider joining. Go to the instituteofcoaching.org, where you'll find a lot of incredible research studies just like this one to help you with your practice. And we'll see you all very soon. Take care.